In recent years, the relationship between diet soda, sugar-sweetened beverages, and diabetes has become a focal point of health research. This comprehensive review delves into various studies that explore how these beverages and their sweeteners impact diabetes risk and related metabolic disorders. By examining the findings from diverse populations, including the Northern Manhattan Study and the Strong Heart Family Study, we aim to provide a clearer understanding of the potential health implications. The insights gathered here are crucial for informing dietary choices and recommendations, particularly for individuals at risk of or managing diabetes. The Northern Manhattan Study highlighted a concerning trend. Sugar-sweetened soda consumption was positively associated with an increased risk of diabetes. Surprisingly, diet soda consumption also showed an elevated risk, especially among overweight or obese individuals. This suggests that switching to diet soda might not necessarily lower diabetes risk. The multi-ethnic study of atherosclerosis further supported these findings, linking daily diet soda consumption with a higher risk of metabolic syndrome and type 2 diabetes. These associations were not entirely independent of baseline adiposity, indicating that diet soda might contribute to metabolic risks beyond weight considerations. The role of non-caloric artificial sweeteners, or NAS, in diabetes risk remains a topic of debate. The Strong Heart Family Study, which involved 1,359 American Indians, found no statistically significant associations between NAS consumption and fasting insulin, fasting glucose, or incident diabetes. This suggests that NAS and diet soda might not be directly linked to diabetes risk. However, the mixed results from various studies indicate that further research is needed to fully understand the potential metabolic impacts of these sweeteners, especially in populations with existing metabolic conditions. For individuals with type 2 diabetes, diet soda is often recommended as a substitute for sugar-sweetened beverages. However, studies show mixed results regarding its impact on glycemic control. While some research indicates no significant effect, others suggest possible metabolic disruptions caused by non-caloric artificial sweeteners. A study involving 200 patients from a diabetes center in Tabuk City, Saudi Arabia, found that diet soda consumption was associated with poor glycemic control and diabetic retinopathy. These findings underscore the need for personalized dietary recommendations for diabetic patients. The multi-ethnic study of atherosclerosis revealed that daily consumption of diet soda was linked to a higher risk of incident metabolic syndrome and type 2 diabetes. These associations were not entirely independent of baseline adiposity measures, suggesting that diet soda consumption might contribute to metabolic risks. This highlights the importance of considering individual metabolic profiles when evaluating the potential health impacts of diet soda. As metabolic syndrome and type 2 diabetes continue to rise globally, understanding these associations is crucial for effective prevention strategies. The Framingham Offspring Cohort Study provided insights into the relationship between beverage consumption and insulin resistance. Regular consumption of sugar-sweetened beverages was associated with a greater increase in insulin resistance and a higher risk of developing prediabetes. In contrast, diet soda intake showed no significant association with insulin resistance or prediabetes risk. These findings suggest that while sugar-sweetened beverages pose a clear risk, the role of diet soda in insulin resistance remains less certain. A study conducted in Tabuk City, Saudi Arabia, involving 200 diabetes patients, found a link between diet sugar-free carbonated soda consumption and poor glycemic control, as well as diabetic retinopathy. Additionally, non-caloric flavor consumption was associated with obesity. These findings highlight the potential risks of diet soda consumption in diabetic individuals and emphasize the need for further research to confirm these associations and guide dietary recommendations. The reviewed studies consistently indicate that sugar-sweetened beverage consumption is associated with an increased risk of diabetes and related metabolic disorders. While evidence on diet soda and non-caloric artificial sweeteners is mixed, some studies suggest potential risks, particularly for individuals with existing metabolic conditions. As the prevalence of diabetes continues to rise, further research is essential to clarify these associations and inform dietary guidelines. Understanding the nuanced impacts of these beverages will be crucial for developing effective strategies for diabetes prevention and management.